discussion on behalf of the Astron E-College, an e-learning platform of the Astron Institute of International Studies. Our today's theme is Nursing Quality Management, which happens to be the core of the healthcare quality delivery in any organization. A lot has been spoken about healthcare quality, but we need to understand that the quality goals cannot be achieved until the heart and soul, our nursing practices and our nursing services are brought into the quality ambit. As we focus on this special field, I have the pleasure to welcome our super speakers of today, Colonel Binu Sharma, Senior Director Nursing, Max Healthcare, Dr. Nirja Sood, Assistant Professor, School of Health Sciences, IGNOU, Ms. Deepa, Head Nursing Services and Principal National Heart Institute, Ms. Jolie, Nursing Superintendent, W. Pratiksha Hospital. As we start, I would request our lead panelist, Colonel Binu Sharma, to let us know her opinion on a very, very important issue, that is, does the nursing empowerment impact high quality care in a hospital setting? Over to Dr. Binu Sharma.
I also compliment all the esteemed speakers on this panel. Dr. Nirja from IGNOU, Deepa representing the National Heart Institute, the clinical part, as well as the education out there, Ms. Jolie from one of the OBG setup, W. Pratiksha, and myself from, again, a corporate sector. All of us represent quality in a different manner in the healthcare. And you're asking me about empowerment. I think if we all were not empowered enough, we would not be on this panel. That's to begin with. I have an army background. Right from the time we joined the army as student nursing officers, we were taught empowerment as a nurse. Empowerment is not just showing your power or a designation or a rank. Empowerment in nursing directly leads to safe patient care, better patient outcomes, autonomy of the nursing function. Other people in the healthcare setup may or may not understand nursing 100%. Hence, having the ability to effectively motivate and mobilize yourself and other members of your team to accomplish positive outcomes in your day-to-day practice and in the work environment is what I will call empowerment for nursing. It has many aspects, clinical and non-clinical. If I may just quote a few examples of non-clinical, the nursing administration part of all important decision-making forums. The nursing being represented not just at the bedside, but at the boardroom to decide the working hours, to decide the autonomy of the functions. Nursing having ability and empowerment to design the policies and procedures for patient care. There are other type of clinical empowerment, like a nurse able to start action immediately for a patient with hypoxia, a patient with hypoxemia, prevention of deep vein thrombosis, actions on prevention of hospital-acquired pressure injuries. There are multiple examples. In fact, the NABH speaks about empowerment. The nursing excellence has an objective element on empowerment, and that just got added a few years ago. So empowerment is a critical thing for not just bedside nurses, but nurses at all levels, because nurses are the custodian of patient safety. And if we have empowered nurses, we will have enhanced patient care, better patient outcomes, excellent services for patients, and increased scores of patient satisfaction in any hospital is my take on empowerment.
Thank you so much, Dr. Binu. Actually, it is very heartening to hear, and also from a strong person like you, who has been always at the helms of affair of the nursing services everywhere, holding so many years of experience with you in the corporate sector. And actually, I totally, very well said, actually, the nurses they are something like a pillar in every hospital setting. Wherever they are, they a strong leader, a strong empowered nurse will actually bring in positive outcomes wherever they are. Very well said. Thank you so much. And Kalpina, may I now request you to take over with other panelists, please, and continue, please.
Okay, Dr. Nehru. So let me first of all start maybe with Dr. Nirja Sood. So Dr. Nirja has a long experience in the field of academia. We all respect her so strongly. Right now, she is with IGNOU. So Dr. Nirja, I wish to ask you, what are the challenges being faced while implementing nursing quality management standards in any healthcare facility? It is very difficult to set these standards. So what are the challenges we all face?
Thank you, Binu. It's nice to be associated with you after a long time. I should say I had a wide experience of working in the hospital, even as a staff nurse in my initial career. Then I worked in a public health in the field, rather even the public health programs as a administrator also. And then I came to education. So in that way, I think seeing all the areas, even the administration for 13 years, I feel quality, you have said the empowerment of nurses, but I always put question mark in that. Empowerment of nurses, definitely. There are some institutions where nurses are empowered to take decisions, but you see, over and large, it is a big challenge for the nurses to take decisions. They are the crucial part of our health system, as Dr. Neeru has also emphasized, seeing what people are doing and what are the deficiencies. But if you see the current scenario of the quality management, as per the evidence, it says it has to be defect prevention, continuous process improvement, and outcome improvement, which actually leads to patient satisfaction and patient safety. That is very important. Because the patient satisfaction is the desirable outcome of our quality insurance program. That's why our patient care, what our nurses are providing, that actually needs standards, protocols, which needs to be followed. I agree, there are very good private hospitals which are doing excellent work. I would say their efforts are being made to improve the quality of the care. If you see, even in the public sector, government has come out from 2005, from the time the National Health Mission has come. There are lots of standards for everything. But again, the question is, if these standards are there, why these standards are not being implemented? If these standards are being not implemented, what are the background factors? Because we as a nursing are not independent. We are a part of a big health system. And what is the decision making power and the empowerment, and you can say autonomy of our nursing? That is a big part which has to be taken care of in the long run. The challenge of low quality healthcare is not unique in India. The studies have shown this is very common in developing and the developed countries also. And there are studies which are giving the evidence about it. I don't want to go in detail about the studies at present. Rather, I should say, in addition to low quality of care, which is due to various factors, it is important to understand what are the processes of delivering the healthcare. Are they standardized? And what are the factors actually that impact the process effectiveness? And there are certain challenges in general I would like to come out, because I feel there are institutions which are being accredited, but after accreditation, there are incidences, and even research have given the evidence, they have again come out to the same level from where they started, because accreditation is not one time, or quality is not one time. It is for continuous process. So one has to see what role and what, I should say, what nurses can do to maintain that quality. That is very essential to see. Some of the challenges, I should say, there is lack of sound governance and administration and the legal authority and responsibility. Financial allocation is a big constraint in most of the institutions. Work culture, it actually matters a lot. Then reskilling them, capacity building, retaining the good staff. Then the monitoring and the follow-up system is little weak. Our health information system, management system, interpreting that data for the quality, that actually is a big challenge in the nursing. When I am teaching nursing administration to my students, I have found they know there is something called quality, but they do not know what is the system in their hospital which is being followed, how to analyze that data and interpret what they can do. Then lack of evidence and lack of research, which actually needs strengthening in our nursing. These are some of the things I should say I wanted to highlight this. Therefore, rightly you have said empowerment of nurses is very important. Thank you so
Thank you.
much.
Thank you, ma'am. In fact, we are just around the International Women's Day, and you rightly pointed out women are not empowered in our society, and majority of our nursing strength, 75 to 80% are women. So by personality, they are little submissive, they are little meek, they do not stand up, even when it comes to patient safety and patient decision making. So let me move to Ms. Deepa. So, Deepa, let me ask you, beyond the bedside, the role of nurses in quality healthcare system. What are your comments on this very interesting topic?
I would say we ourselves project ourselves beyond the bedside. So the answer comes with all four of us. But to a little elaborate on this point, I would say that nurses in the past as well as the present have exemplified themselves as great bedside nurses. And it has now challenged us. In the past also, there were a lot of challenges. Madam has already spoken about it. And we have overcome those challenges. And we have overcome with those challenges with we can say we have come above it, and we have projected ourselves very strong. And we have also projected in nursing that all the challenges, in spite of whatever we faced, we have come above it. And today we have remarkable kind of growth which we have seen in our nursing profession. We have come like it's something like the ashes have become to the phoenix, to come to a level where we that yes, we are empowered, fully empowered, what you were telling about. So we have a continuum from birth to death. The first person who touches the life is a nurse, and the last person who touches the life is a nurse. So in that continuum, we have every point a nurse can work from that birth to death. So I feel that we have to use that point. We have definitely touched many, many points of that continuum, but there are a Pandora box which is still to be explored. Okay. And definitely the future generation, the Generation Z and the millennials of today are the entrepreneurs, and we will definitely go beyond our levels. And what few things which we see in today's time, it is the best time for us to expand and wings and fly high to infection control, nurses, wound care, pain management, palliative care. Then we have rehabilitation, diabetes, education, which was, I think, even 2 decades back, nursing education in the hospital setup was not that large. And today it's a department by itself. So all these things have come because we have thought beyond the bedside. We have touched every point of our service area. And not only in the clinical part of the hospital, but the non-clinical parts of the hospital, something like the OPD managers, the patient care coordinators, then in the medical records reviewers, then home care, which has come up in big folds during the COVID, and now it is expanding large. A very big area which I would say statistically we are not very high in numbers in that area is the public health. Though Madam has spoken at length about public health, but there is this area which has to be explored at a very large level, and our requirement as nurses have to be more on the preventive aspect rather than the curative aspect, which we are presently targeting only on the curative part of it. Then there are areas which are enlarging into multiple folds is research and development. There are lots of nurses now in clinical trials, which are approved under the DCGIs and all. And we have products which are coming up, the healthcare products. The nurses are involved in the product development, as well as the marketing of it, as well as the utilization of it. So there we have seen a lot of nurses of today's time who have gone into it. Digital health has come into large purview as technology is going to be the next driven area of the next decade. Then we need to develop a workforce which would be technologically competent and towards the direction of keeping high tech in our system, but keeping our roots of high touch always intact, because we as nurses believe into a lot of high touch. Till the time we are not touching the patient, we are not at the bedside, we would never grow. So my summarization of the question would be that anyone who has the undying desire to care would find out, would be an entrepreneur by itself, would develop. Entrepreneur does not mean only producing something or making a product, but even in our day-to-day life, how we work at the bedside or beyond it, would be able to do it. And someone who has dedication towards the bedside would always go beyond the bedside. So that is my take on the answer, a question.
Thank you, Deepa. Let me just add, yes, nurses are a critical part of the quality management system in the healthcare, even in India. Just giving you examples of NABH assessors, multiple principal assessors are our nurse leaders. Multiple assessors are our nurse leaders. Nursing excellence, another quality initiative in the country, is completely driven by the nursing leadership. Also, nurses have shown their empowerment and their quality passion at the time of COVID era for last 2 years. Nurses have taken on the entire responsibility and accountability of setting up flow processes, mobilizing manpower, training, having the donning, doffing areas, doing virtual call with the patients, managing home care. There are n number of examples. Rightly said that nursing quality and nursing leadership, which we can merge in so many ways, is already evolving to a great extent in our country, and we are only on the rise now. She gave examples of stoma care nurse, diabetic nurse, wound care nurse. Education department is expanded in each of my hospital. I've got 4 to 5 team of quality nurses itself.
Yes.
They only work towards quality. On improving, on analyzing incidents, RCAs, looking at trends, improving, redesigning, re-engineering SOPs. So there is a lot. Let's move to Ms. Jolly. So Ms. Jolly, let's ask you, what tools should we be using to monitor nursing quality indicators? We all know we need to monitor a lot of quality indicators. So what tools can you recommend to us?
Thank you, ma'am. It's a very nice opportunity which we have received as leaders to subject about this thing, and we have to talk about such an important topic, that is nursing quality management. And as we all are leaders, we all know that a quality nurse is something which is very much required in nowadays in any organization. So the every hospital, after building up a new hospital, every hospital goes for accreditation. And once after getting the accreditation, to sustain it is something important. And to sustain this accreditation or quality, to maintain the quality, the indicators are very important. So many hospitals are there, those who are looking only for some sets quality indicators which are given from the NABH, like 32 indicators are there total, and this many are for the nursing, these are for the other departments, like that. But I'm of the opinion that as nurse leaders and as a quality nurse, we should have some our own quality indicators which we should select, and we have to monitor for our own improvement in our department, nursing department, according to the different hospitals, their own hospitals. So in order to monitor and maintain the quality, there are some tools which we must use, because the data driven decisions will only carry some importance in implementing any quality improvement projects. So until and unless we don't have data, we will not be able to justify that where we need improvement and where we are lacking, or what is the problem which is prevalent. So therefore, there are some quality safety tools, patient safety tools are there which we can use. That is like we can do a safety survey. We can do like reporting some incidents or errors, report error reportings. We can go about our record reviews retrospectively or prospectively. We can check our records and find out what was the problem. There are many such tools like Ishikawa diagram is there, like fish and fishbone diagram, with which we can find out what is the cause and effect. The cause and effect is something which is very important to analyze the root cause. If a problem, if an incident happens, then what is the cause of it, that particular problem is very important to know. Until and unless we don't understand the root cause analysis of the problem, we will not be able to take a corrective action, or even we will not be able to take a preventive action. So it's very important for us to understand different tools are there, like the tools are there for identifying the problem, which problem is causing more effect, more impact. For that, there is a Pareto chart which we can use to identify that which problem is having more effect. And for data collection and analysis, we can have a checklist, we can have a process mapping, where we can mention the process in one side and we can map the process, what is happening on ground. So this is there our quality nurse plays a major role in data collection, analysis, and even every nurse, every link nurse is important in that case. So these tools can be used to identify, as well as there are some tools for analysis, like FMEA, we say that failure mode effect analysis. So that can be used to understand where we are failing and how we can improve upon it. So there are different tools which we can use to ensure that our indicators are monitored and we are working to improve our nursing department. Thank you, ma'am.
Thank you, Jolly. We are already running a little short of time, so my second question to each speaker needs only less than 1 minute answer. So I'll be quick on my question, and I request all of you to be quick in your answer. To Deepa, is nursing quality an end-to-end process, or is it just the dashboard compliance? You are mute, Deepa. Yeah.
A very intelligent question, I would say. I would say my answer would go is a mix of both would be better, because a dashboard is definitely required, because it would give you a track. It would not let anything of the quality parameters which are being set by the institution or by the accreditation body missed, because if we are not keeping any track, if we are not keeping the dashboard, then we may miss some important and take some minor ones on the way. So, well, the dashboard is important, but it should not function as a blinder for the horse and just to keep it on track. So it has to be a little larger. And today's time, nurses are definitely wider and they're not using the blinders. If you read the nursing care plan and the nurse's note, beautifully they depict, 2 fingers of the patient of the left hand started moving today at night. So that shows that, yes, it was not moving for a stroke patient. Today onwards, it has moved. So it is giving you direction towards the treatment part of it. Not only clinical side, non-clinical side, also nurses are coming out because they are given the freedom. The culture of the organizations are definitely developing. Definitely, there is a large number of hospitals who would require further to bring those kind of personnel to work. The leadership has to go very strong. And that is the reason why we should have a lot of training and educational programs where our perspectives open up. The nurses, they have a wider perspective, and evidence-based practices are being utilized in every hospital in today's time. We are talking today of the researches done by the nurses and implementing those. Every hospital in today's time has a small nursing library where we have nursing journals. So nurses are reading that, implementing those. COVID times, nurses used a lot of evidence-based practices, and now also they are using it not only in named hospital, but even at the grassroots level also it has been seen. So my take on it would be that it should be an amalgamation, and you should have such kind of leaders and the quality personnel working in the nursing department. They should have good quality education, additional education to what nursing is, and beyond that also training is important, and some good rich bedside experience, and then definitely that would be taken.
Thanks, Deepa. Ma'am Neerja.
Yeah.
Do QA nurses have a career growth in our country? Do we also have nurses going through a qualified course before they take up the job? Quick answer, please.
Yeah, you have asked a very, I should say, burning issue. I should say, hardly I have found very few nurses, I can say it may be a 0.2% who have their own personal interest go through these type of courses. And because, yes, that is, I have visited almost full India, public and private sector. And the other thing is, they are prepared. Yes, our curriculum is very strong, no doubt.
Yes.
But the way it is being implemented, it is a big question mark. Very bluntly, I am saying this because when they come out, I was a part of training of nurses when they are recruitment in the government and in various private sector also. I found their skills, even when my students since last 15 years, I'm teaching management and administration. The skills are very poor. Right, Deepa has said the research and the evidence, I should say that percentage is also very, very less.
Minuscule.
Yes, it is 0.5%. I have personally done a study where the research skills, management, leadership skills are missing in nurses. Yes, I should appreciate the part the public private sector plays in orienting them and on the job training. That is excellent. But on the other hand, we are losing them when they go abroad. Then you have to again retrain them. So that is a big challenge. I should say in a simple word, accreditation is not one time. And nurses also should feel it is not a race, accreditation. It is for the quality and the patient satisfaction, the accreditation is. So those concepts, they need more strengthening, analytical thinking and the critical thinking. Rightly, Jolly has said the data analysis skills, IT skills, these are the missing parts, although it is there in our curriculum, but they need strengthening. That is, I should say, nurses has a great potential, especially the young generation. If we train them, they will become excellent nurses. Thank you.
Thank you. Thank you, ma'am. Jolly, quick question to you. What's the role of a quality nurse? Is it well defined in the hospital, or is she jack of all and master of none?
the quality nurse is someone who can have, who is a person to whom we have to, the management and the leaders, we have to give a power that she can take a decision in terms of improving the quality care of the patient and safety of the patient. And that includes each and every one down from the down level till the higher level, till the doctors, that is whoever is in direct patient contact. Whoever is in direct patient contact, from the housekeeping till the doctor, she has the right, or she should be empowered by the management to guide them so that
She
she can
should be
directly improve.
empowered. Is she empowered on the ground? Is my question. Is she empowered? She should be empowered, yes. Is
Yes.
she empowered in our setup?
In our setup, there are many hospitals where they give that power there, but there are some hospitals where the understanding about the nursing quality and the role of the quality nurse is not that much prevalent. So in that case, there are less power to the nursing quality nurse. But the organizations where they understand the importance of the quality, they are definitely giving that power, and the nurses are directly taking that power in improving the patient care.
If
Okay,
you mind,
thank you,
don't mind,
Jolly.
Binu, I would say only one point. The tertiary level private sector, yes, I can say maybe 5 to 10% total of the nurses, but not in the public sector and the small private sector and the nursing homes. They have not
I
given
agree,
any
ma'am.
empowerment
Agreed,
to the
ma'am.
nurses. Yeah.
I agree, ma'am. Nurses have their separate department, even though there are quality nurses, they work in one narrow
Yeah.
bandwidth. The medical quality team works in another bandwidth.
Yes.
The general quality works in another bandwidth, and most of the times the three lines are parallel to each other
Yes.
and
Yes.
rarely meet.
Yes.
For the purpose of safe patient care, improved patient outcomes and satisfaction, they three have to merge together.
Yes. Yes.
We are wishing and hoping and envisaging those times. With that, I end the questions for all of you. I do have a question for Dr. Neeru, but before that, let me just summarize only in one statement. Having empowered nurses, having nurses with right qualification, knowledge, passion, hard work, dedication. We heard we are evolving. If the nurses do not have effective communication skills,
Yes.
whether it is speaking skills, writing skills, communicating between staff members, we are not going to achieve anything. Whether it is communication between nurses, communication between nurse and doctor, communication between the nursing administrators and the staff members, communication between patient and family members, communication between all other caregiving departments, a dietitian, a physiotherapist, the pharmacy, the laboratory. Unless we have an effective communication system, unless nurses have the ability to communicate and not to go into Chinese whisper, we are not going to achieve effectiveness in our nursing quality management system, which definitely needs to high quality nursing care. With that, Dr. Neeru, my question to you is, we all discussed nursing quality. So do you at Astron, after listening to us, do you think there is a need to design and devise and initiate a program to qualify nurses in a quality management program? Have you come up with something, or do you have the vision of it? And do you think hospitals will respond well to this program and allocate education and training or learning budgets for having nurses trained formally in a quality program?
Thank you so much. First of all, let me thank the Super Speakers team. It has actually been a very, very meaningful and a very, very positive discussion which has happened. Thanks once again. Now, coming to the question from Dr. Binu. Now, see, since we've been discussing the involvement of nurses is on the rise, whether it is implementing quality standards or CQI or digital technology, work culture, or communication skills. So at the end of the day, everything is converging to skilling and reskilling of our nurses. But at the same time, before we have actually initiated some steps at the Astron, but this has been done keeping in view that we actually take what is the status of the nurse on ground. She is busy, she wants enhancement, then the enhancement has to cater to her personal life, her personal time. That should not be taken away. Then her availability of resources. So all these taken care of. So we have kept a very, very broad-based approach at the Astron College, considering the industry needs, considering her personal needs, her personal availability. So at the e-college, we have tried to cater to the demands of the nursing professionals, and we have tried to bring in pre-recorded video-based sessions which have been designed by the industry experts, not only for the nurses, but for the healthcare, clinical management, non-medical fields, also the soft skills, where Dr. Binu said that communication skills are very, very important. So soft skills have been adequately catered to, and also looking at the burnouts and the pressures she has at her work, motivational programs are also there. So now talking specifically about the nursing empowerment. So the fact of the matter is that she is most of the time she is just involved in her routine practices, and she's just involved in that. There is hardly the orientation, the sensitization towards quality, infection control, nursing audits, specialized fields like trauma, critical care. Those are actually minimal. Now the attempt at e-college, what we have done is, which the hospitals have also welcomed also. So this is that we have tried to open up all these fields to cater to all our nursing professionals in a very easy to do, very easily accessible, short duration and low cost modules, so that more and more of our nursing professionals can be skilled and reskilled. And in the first phase, initially, actually, this has already been launched. And in the first phase, in terms of nursing quality, we've actually launched a advanced certification in nursing quality management, which is just 3 modules course, which is pre-recorded video based, and she can do it anytime. Lifetime access to the certificate is there, and she can complete the course anytime, whether in 2 hours, whether in 2 months, whether in 6 months. There is no binding to that. She can open anytime and do it. Assignments are there, very simple assignments are there. Immediate, the certification will be downloaded immediately. Accreditations are already there. The certifications are already there. Along with that, the Astron Institute of International Study is accredited by the NABIT, Quality Council of India. So that assurances are already there. So any girl who wants skilling can be done here. Along with the nursing quality management, we've launched courses on certificate course on infection prevention and control program. Healthcare quality management is there. Then very important aspects we've touched in: pediatric fundamental critical care support, certification in clinical governance, safety and quality in healthcare, trauma services, care and compassion to trauma survivors. Now this is the first phase, and in addition to that, touching the communication skills and the soft skills, we've come up with certification in emotional resilience, work-life balance, emotional intelligence, networking skills. So things like that we have tried to come out, so that there is a holistical development of our nursing professional, which will actually add to what we are looking at, the positive outcomes in the hospital.
Ma'am, I have one question on it.
Sure.
You have told that there are pre-recorded videos and training sessions and everything. What about the skill development, the hands-on, which the nurses would need to develop to raise their competencies?
Yeah, so this is one part of it. The hands-on is other component of the institute, wherein we are providing online programs which are 3 months and 4 months and 6 months, wherein the hands-on component has been added. For example, the infection control nurse. any girl who is a BSc, she's just come out of it, just has got 1 year, 1 year of experience or 6 months of experience, she does the 3 months online program. We have a course coordinator, generally an NABH assessor, who is there as a coordinator and taking the, she does all the study on the online, which is through the user ID password access, and she gets one hour of weekly this association with the course coordinator, wherein all the queries are solved. She has studied the entire week. She has certain queries for 1 week. A time is scheduled, and then she can solve all of her queries for that. But along with that, the 4 months course will cater to 3 months of online teaching, and along with that 1 month of hands-on training, where she will be deputed in one of the major corporate hospital, where they have a mentor, and then they are doing the hands-on for the 6 months period. Similarly, it is 3 months and 3 months. Dr. Binu has actually helped me do the hands-on training for some of the nurses, which I requested her for the infection when she was in Bangalore. Thank you so much, Dr. Binu, for all the help you always keep on giving us.
So I was going to say that online courses are good, but nursing being quite a bit of hands-on skills. A nurse might know entire theory, anatomy, physiology of the circulatory system, the veins and everything. Unless she does a skillful, first time successful cannulation, her knowledge means nothing to the patient. So for every program for nursing, most programs for practicing nurses should end up with a hands-on practice somewhere in some hospital, so that she is procedure ready or she is patient ready. That should be our parting statement to Astron. Thank you.
Well taken, and thank you so much for such a good suggestion you've given us. The future courses which we are planning, we will definitely see that we add that, which is a vital component for the nurses.
Yeah, can I add one thing? Even in your other courses like effective communication and other courses like this, you can add various online only case studies and the role plays.
Yes, sure.
They can do online role plays. This is, yes, technical skills, they have to go face to face.
Right. We'll do
But
that.
some of the things you can add case scenarios in your programs, and you can have a role plays even online. It's not difficult. During COVID, I have done experiment with my students. They were very successful.
Yes,
Everything is possible online through live role plays. Ma'am is very right. You can get all of this. You give them a case scenario and they enact the scenario live online. There is a moderator to manage it. There is a evaluator in the same session. We all have done it during COVID when the physical interaction was limited for the nursing team.
But again, you should have guidelines for that.
And it was possible.
Yeah, but you should have proper guidelines for that.
Yes,
that is
That's
very
what you must have guidelines.
Yeah.
You should have a good evaluator. You should have a good moderator, etc. I think we have overshot the time quite a bit.
And only one last thing, if I'm permitted, I have gone to Gujarat, where the Gujarat government has done training for nursing excellent. But one thing I really, what Binu was telling, they have not only invited nurses, but there was a mixed group. They were given trainings, then they have gone back and worked in the teams in their hospitals to bring in quality. That is the only in Gujarat I have seen. Nowhere else I have seen that.
That should be the approach, ma'am.
Yeah.
Otherwise, it's incomplete for nursing.
Yes.
There are only 28 states remaining, ma'am. It could be done.
Yes, Deepa. Parting shot.
Yes.
Thank you, Dr. Neeru, and thank you, everybody. Interesting and meaningful session.
Thank you so much, Dr. Binu. Thank you so much. Thank you, all our panelists. It has been actually a pleasure, and we wish to conduct more such panel discussions where we can come up with more good suggestions for there. Thank you so much.
Thank you so much.
I request for your support always as super speakers. Thank you.
Thank you so much.
Thank you, Ji. Thank you so much.
Thank you, everyone.
Thank you. Bye. Thank you.